this event over the past year and a half has been an epical event and devastating to many people and overwhelming to hospitals all across the country. But I'm going to stick to what I know, and having cared for people in the hospital, I have to tell you, taking care of the very sickest gives you the best respect for the opportunity to avoid this disease. And I think that's missing in the public. I don't know how well people in the public see the devastation this disease has had on a great number of men and women, many of whom have passed. I mean, looking at a CAT scan that looks like rats have chewed your lungs, that will never get better, I don't think you see that in the media. And I'm afraid they've kind of forgotten that COVID is a scary disease the minute the incidence starts to drop. I think we're in the eye of the storm. And if we don't do something between now and fall, when people start crowding together again, it could have devastating consequences. And it's so hard to bring that to life for people. And you know, I think through the hospital and the health department, the best people to talk to about how serious they are about vaccination are the people who've taken care of the sickest. And I think we have to find a way to get people with concerns, and it's good to have concerns about the vaccine, get to that level of information and that kind of motivation. Because it's much less abstract, it's very visceral. They're terrified, and I was terrified. So is it safe? It has some side effects. I think the national media is like drinking out of a fire hose in terms of getting information. You can choke on it. And I encourage you to stick with healthcare professionals you trust and people who've had experience, especially in the hospital, dealing with these patients. People that might not understand how vaccines work, the concept is we take a spike protein off the COVID virus and find a way for our immune system to respond to it. The mRNA vaccines are an amazing development, and that's been worked on for over a decade, that has been able to stimulate your immune system but never get into your DNA, which I know is a public concern. It lasts no more than 2 or 3 days in the cell tissue, and then it's completely out of your body. If you're worried about being trapped by a bot from the vaccine, you should get rid of your cell phone. And you may think that's a funny thing, but there are way many people than I would think actually have told me this. So try and keep things in perspective. You know, I think we want to keep moving forward. When you choose to cross the street, there's a finite risk you'll get killed or hit by a car, twist and break an ankle. But you do it anyway because you want to do what you want to do and you want to live your life going forward. And that's how I think we should look at the vaccine. Am I going to cross the street or not? It shouldn't be much harder than that. And if you need more reassurance, I'm sure between the health department and the hospital, especially in getting contact with people who have seen the more severe cases, I think that's the fear we should worry about, not fear of adverse effects of vaccines that are fairly safe and being well monitored. Lastly, say we did the AstraZeneca vaccine trial, we're still in the middle of that, and enrolled 270 people here, 370 people, forgive me, in Butte, so about a third of whom got placebo. The rate of vaccine-related adverse events, fevers, chills, muscle soreness, was the same in people that got saline vaccinations as the ones who got the AZ vaccine. And you know, that's an experience that you have to see to believe, but that's our human nature. What we fear will happen will often sometimes occur. You know, it's the placebo effect in reverse. So when you've seen placebo patients come in and tell you they're sure their arm's going to fall off, or that they've had a terrible fever and they can't swallow and their throat's sore, and you have to tell them it was just saline. It's not making fun of them. It's kind of illustrating how vulnerable we all feel when we expose ourselves to something we haven't exposed ourselves to in the past. So with that in mind, I think trying to keep communication open with the healthcare providers at community health and at the hospital and through the health department. I'll do all I can to talk to anybody. The last person in my office to be vaccinated can't even articulate why she doesn't want to, but I told her I would drive her there when we're done here to Kelly's office. And she said, okay, I'll do it if you go with me. I mean, let's do anything we can to get that shot in her arm. Thank you.